If your baby is squint, they can go blind forever in the weak eye and cannot be recovered even if the squint is surgically corrected too late. So know how to check if your baby is squint and what to do about it immediately. I'm Dr. Chris, MD, helping mums to be happy and raise healthy, happy babies. Now, as a family physician, I've delivered more than 1,000 babies like yours, and I have coached tens of thousands of mums just like you with their newborns. So what is strabismus? It comes from the Greek word strabos, means squint, which means cross-eyed. So strabismus is when eyes don't line up, or when one or both eyes wander. The eyes may turn inward or outward or up or down. Now, when the two eyes don't line up together, the more straight eye rules the vision. So the vision strength or the acuity or sharpness of this eye stays normal as the eye and its connections to the brain are working well as they should. And the misaligned or a weaker eye doesn't focus as it should on objects, and its connection with the brain doesn't form correctly, and it goes blind eventually, and after a few years, as the brain switches it off to stop seeing any double vision, there's no more sight from the eye. Sometimes strabismus is very noticeable, but other times it might only be noticed when a child is tired or looking at something very close up, and you can see the squint of the eye turn. So strabismus usually can be fixed when found and treated early. If it's not treated, the brain eventually will ignore the visual image of the weaker eye. This change is called amblyopia. Ambly means dull and opia means eye, so a dull eye or a lazy eye. It can make blurry vision or cause double vision and harm the child's depth perception, like seeing in 3D or in 3 dimensions. That doesn't happen anymore. These problems can become permanent if they're not treated. Please subscribe and click like if you're getting value from this video. Then in the algorithm, YouTube will show it to more people. It's very important. All mums know this. Now, how to diagnose it? Kids can be born cross-eyed or develop it during childhood. Often it's caused by a problem with the muscles that move the eye, and it can run in families. It's normal for a newborn's eyes to wander, when they're very young, or cross occasionally during the first few months of life, because they're focusing right up close here. But by the time the baby is 4 to 6 months old, the eyes should straighten out. If one or both eyes continue to wander in or out or up or down, even once in a while, it's probably due to strabismus. Now, if grandma says baby is squint, always believe grandma and have it checked out, please. You should see the eye doctor without delay. So the cover test is easy to do. You show the baby something interesting to look at, and then move your hand or an object into the one eye's line of vision. Do this on both sides, and if the unblocked eye is jumps straighter as you cover the other eye, then this one that jumped into focus is likely squint. So how is strabismus or squintness treated? The earlier strabism is treated, the better. This is because the key connections between a child's eyes and the brain form up to about 8 years of age, and it's important we have this time during which we can make a change and correct this. Now, the baby or the bigger child might be given an eye patch to wear over the straight eye for a few hours a day, so that we force the lazy eye to do some work and strengthen its muscles. This patch makes the weaker eye do all the seeing work, and over time the muscle and vision in the weaker eye becomes stronger and makes more connections to the brain. Getting a baby or toddler to accept wearing an eye patch can be a challenge, but most kids get used to the patch. Now, wearing it becomes part of their daily routine, like getting dressed in the morning. So sometimes when they are bigger, wearing eyeglasses is enough to straighten out the eyes. And sometimes, though kids refuse to wear an eye patch, then eye drops called atropine drops might be used instead. Just as eye patching, this blocks out the vision in the straight eye, it makes it blurry. The atropine drops will temporarily blur out the vision in that eye, and this makes the weaker eye work harder, so that eye muscles and the vision get stronger in the weak eye, because we're blurring out the strong eye. Now, how are you enjoying your baby? Do you have any challenges? Comment below. I'll make more videos. Just tell me what you'd like. This is Dr. Chris signing off. Ciao, mamas. Thank you for watching.